Hi, everyone. My name is Dr. Tricia Sheridan. I'm the Women's Health Nurse Practitioner Program Coordinator, and I'm doing this video to tell you a little bit about our specialty and the program at Emory. So first off, I'd want to introduce you to the team. So I am on the one side with the blonde hair, Tricia Sheridan. I'm a Women's Health Nurse Practitioner and a forensic nurse. I've been at Emory since 2015, the program director since 2016. And my background is in forensic nursing and also family planning. Over here is Charlene Maynor. She is the co-director of the program. She has been with Emory since 2006. She's been a nurse practitioner at the OBGYN clinic since 2013. We are both board certified from NCC, and that's who certifies all WHMPs. So defining the WHMP specialty, we're sort of like this cool little child in the middle with the Batman in a room full of princesses. So most specialties are defined by the population, whether it's adult or pediatrics, or it's inpatient or outpatient. And WHMPs, we aren't defined by that, right? So we do start working with patients at puberty, but we go all the way throughout the lifespan. We work inpatient, we work outpatient, we work in subspecialties that range the gamut. People often get confused and say, well, you only work with women, and that is not correct. We can provide primary care to those who identify as female, and we can provide sexual and reproductive health care across the lifespan, starting at puberty and all genders. And I think that's really important, and that is what differentiates us from some of our other specialties. A lot of times people ask us, what's the difference between midwifery and women's health? Well, the biggest difference is that we do not labor patients, and we don't deliver patients. We also don't provide care to newborns, which CNMs do. We, however, can do high-risk OB. We can, one of my first jobs was in labor and delivery triage, and more than one patient did deliver in triage because they don't wait to deliver for a CNM or an OBGYN. So you can definitely be part of that process, but in general, that is not our scope to deliver, and we don't do newborn care. And also, the focus is different, right? So the women's health, it is on our boards. Primary care is part of our specialty, and that's not really the focus of the CNM. So I always like to talk about this. So women's health, the W in women's health is, it's problematic, right? It's politically charged. Only in recent years has the need for women's health care and research been actually recognized. We often still find the need to fight for recognition and the importance of our work. But the W also it's not inclusive to everyone. And so we have to talk about that from the very beginning. Women make up over half of the population, and there are lots of barriers to across the board with women. So it is important that we recognize and use the term women, but at the very same time understand that it is not inclusive, right? And that we have to find a way to be inclusive in the patients that we're seeing. this is showing an example of reflection of using the terms that our patients use, but it's absolutely vital that we have to recognize that people across the gender spectrum need our care, and that the W is exclusionary, and so we have to move forward in a way that is respectful and inclusive, because not everybody identifies as a woman or male. It could be a person who is non-binary, but they need care. Everyone needs sexual and reproductive and inclusive care, and so that is our job, to make sure that we are meeting the needs of everyone. So this is what is, according to American Association of Nurse Practitioners, the role of the WHMP is to assess, diagnose, and treat the healthcare needs of women throughout their lifespan. Again, we are working to broaden what people think that the WHMP does. We do work in private practice settings, and we do provide preventative care, breast cancer screenings, Pap tests, contraception. We also provide adolescent health care, pregnancy testing, fertility, prenatal visits, menopausal care. While I think this definition does not go far enough, I will say at least that it does recognize that the WHMPs absolutely consider the interrelationship of social class, ethnicity, sexual orientation, and gender, which is, all encompassing. So what is gender related? Gender refers to the characteristics of women, men, girls, boys that are socially constructed. This includes norms, behaviors, and roles associated with being a woman, man, girl, boy, and the relationships with each other. It's a social construct, and with that, it varies from society to society and changes over time. It's hierarchical, I can't even say the word, and it produces inequalities, and it intersects with other social and economic inequalities. Gender-based discrimination intersects with other factors such as socioeconomic status, geographic location, disability, age, gender identity, sexual orientation, the list goes on and on. Many of you already know that I'm talking about intersectionality. And we know that gender interacts with, but it is different from sex, which refers to the different biological and physiological characteristics of females, males, and intersex persons. We're talking about chromosomes, hormones, reproductive organs. But gender and sex are related, but they're not. It's different from gender identity, and gender identity is how you feel, how the person feels internal, and how they experience gender, which may or may not correspond to the person's designated sex at birth. And we all know that gender influences people's experience, and especially their access to health care. The way that health services are organized and provided can either limit or enable a person's access to health care and support services. So that's where WHMPs we're trying to help bridge the gap. We're trying to have people understand that we aren't, as I always like to say, vagina checkers. It's so much more than that. And we're uniquely poised. And the focus at Emory is very much to expand the role of the WHMP, to work to our full scope, and to really help providers become that bridge in the gap of healthcare for people, especially those trying to access uh, reproductive healthcare services. And then I, as a forensic nurse, am very passionate about trauma responsive care. I talk about this because we start from the very beginning of the program talking about trauma responsive care and also cultural humility. It drives everything about our program, and it's really important to come into the Whmp program understanding that none of us has all the answers. We're learning from each other. We can never be considered competent in cultures outside of our own. And so the goal is to strive for humility. I encourage us to create a brave space that creates open dialogue. We recognize the difference and we hold each other accountable to do the work of sharing experiences and coming to new understandings. And it's often, hard, typically uncomfortable, but that's how we all learn and grow and become, the best providers that we can be for our patients. So a little bit more about the actual program. There are multiple entry points. You can do a MSN, the master's level nurse practitioner. You can go all the way to the doctorate in nursing practice. The program is completely online with in-person intensives once a semester. The first fall of the clinical portion, the master's program, is a week-long intensive, generally towards the end of the semester. And then in the spring, there's 1 day of simulation. The summer is usually 3 days. The fall, the final clinical block is 1 day, but we usually have, if we offer forensic nursing, advanced forensic nursing as an elective. It's not mandatory, but those who take it also come in for 3 days of forensic medical exams. The program is meant to be flexible. There are not enough WHMPs or people who care about doing this work. So we try to make the program as flexible as possible. We want people to become WHMPs. It is, we work with you if you're in Georgia, to have clinicals in Georgia. We don't guarantee clinical placements outside of the state of Georgia, but we have had students in multiple states, throughout. We've had people all the way from Connecticut to Texas. We've had someone lucky enough to go to Hawaii. That is not the norm. I would not recommend saying I'm going to come here to go to Hawaii. And, the world, everything has changed with COVID, and, we're still recovering, the healthcare field in general, getting clinical placements. I definitely say the key to success is flexibility. Our program, you absolutely can work. The issue really comes down to, is your work flexible enough to accommodate your clinical schedule? We don't do clinicals the first fall, then you need 180 hours. This is for the MSN level. There's additional clinical hours for the DNP, but for the masters, you need 180 hours. The first spring, the summer, it is your another 180, and then in the fall, your final is 240. So just over 600 clinical hours for that master's level. That's the minimum number of hours. We are moving competency based. And so some people will take longer to make competency, but really that is what it is all about, is, working with people to become competent and confident to provide trauma responsive, individualized care that's based in research and best practice for our patients. So This is our teaching philosophy and some quotes that I like to share. If it's not anything that you can relate to, women's health at Emory may not be the place for you. Hopefully you are inspired by these things, as these quotes as well. We in Atlanta definitely loved, still love, even though he's no longer with us, John Lewis. Many of us were lucky enough to hear him speak on multiple occasions. And it's definitely always a good reminder that we are going to keep going no matter what, and get into good trouble. All right, that is all I have for you. You can reach me at trisha.sheridan@emory.edu if you have any questions. We are very passionate about our program, and we look forward to working with you all. Please don't hesitate to reach out.